So procedure for level 2, if you walk in, you're going to engage somebody at level 2 and are with your level 3 stuff on, and it's a call type where we require a greater level of PPE. Remember, we talked about this. One person stays greater than 6 feet away from the patient without engaging. The other 2 people go back to the rig, get level 2 stuff on, come back inside, relieve this person. They can start patient interaction at that point. The initial person goes back, gets their level 2 stuff on, and engages the patient, all right? So this kit is on your apparatus right now, and it starts again with the suit, which is a full body Tyvek suit. And mask, right? It's always first when you're going to put stuff on because airborne exposures are your greatest, distance potential.
So as you can see, the couple things that we're adding is the suits, more full body suit. We've got rubber over boots, and on top, so you still got the mask, eyes, gown, gloves, but you also have the face shield over, and these over boots, just so you know, they got some grip on the bottom, so they're not really a trip or slip hazard.
Yeah, they're cleanable. They're also cleanable.
Actually, everything's disposable if it needs to be.
Yeah, it is all disposable if it needs to be.
So I go through the same process. We'll start off more or less the inner gloves. These again remain as your clean gloves. Okay, mask. John, you want to tell them while I do this? Their station needs equipment, how to get it? Just put an order from?
Oh, for a level 2?
Yes.
So level 2 equipment, of course, is ordered through EMS. And you've got a cross on your straps there, too.
Oh, do I?
Yeah. Yeah, so, that's just, an EMS supply order, basically, that's going to go through Captain Getstreet. And, well, as of this time, you got enough stuff to outfit the initial kits. So any needed extras and stuff like that, of course, you have to go through a request through Captain Getstreet.
When we taught the class in October, this equipment had been ordered but still wasn't available to us. So
yeah, so the kits are on the apparatus now. What we don't have is a large cache of this equipment yet, though. So all agencies geared, once the Ebola threat became evident in the United States, of course, there was a huge rush to get additional levels of PPE available to first responders. And so what you ended up with is a lot of back-ordered items. So we did get enough to do an outfit initial apparatus. We don't have a whole lot in reserve, okay? So I'm not saying don't use it as needed. Any call type that you deem appropriate for that. And Captain Getstreet, of course, is working on getting more of these supplies in our reserve. But there's logistical problems because of a lot of agencies went to higher level of PPE all at once. So the boots are a nice upgrade, a full body suit in case you need to get down, with the patient. Of course, sometimes you get the lift, you get full body contact. You're getting knees, bottoms of shoes. Bottoms of shoes is one of the most likely areas of cross contamination. If you think about it, you walk into an area, people that have blood products down on the ground, body fluids and so forth. It's very easy for it to be on the bottom of your shoes. On your knees as you kneel down and engage somebody on the EMS equipment and so forth. So this gives you, full body protection and something that you can doff at the scene appropriately inside a, the biological bag. And so you can, be, free from that earlier on.
Okay.
There we go.
Buddy check.
Buddy check. We're covered. Tony's got,
Oh, I forgot the outside
he's got
glove.
one pair of gloves on right now. That'll be a problem when he goes to doff his suit. He'll end up having an exposed pair of hands. So the inner gloves are essentially clean, right? Depending upon how carefully you take stuff off. The outer gloves are going to be your most contaminated piece of PPE.
You should probably remove jewelry,
You're right, because
watches.
yeah.
And actually, these gloves don't go over the top of the gown. So, other EMS gloves, these black gloves aren't as long as other colors we've had in the past, so that might be something to consider when donning this stuff.
Yeah, I think the white gloves have got a longer sleeve on them.
Do they?
Yeah, let's see. Pull that one off. Okay, so the white glove's a little bit longer here on the cuffs, so.
There you go. So don't use the black gloves
Yeah.
with the level 2 PPE. All right.
Okay, we look good. Tony's covered. I see boots around the cuff there. We've got the appropriate here in the back covered. This mask is on snug. You can move your head okay?
Yes.
Okay, Captain Fletcher is ready to engage patient.
Okay. So when we come out, we'll go through the docking procedures. We just use this same bag. So mask, badge, and gloves. I would actually think gloves first.
Get rid of
Get rid of this outer set of gloves.
get the most contaminated piece off, right? Careful as we pull that stuff off your hands. Remember the snapping, try to eliminate those things.
Okay, so I'm going to need to remove the shield.
Yep.
I set it aside for disinfection. And now I need to remove the gown, which would include the boots as well. Actually, you're going to want to unzip this first. Unzip it down to the waist. And then roll the headpiece backwards. And if you have, a partner to work with, they can do this for you. In fact, actually, John, why don't you just fill that roll?
Yeah.
Grab that and just pull my suit inside out.
So, remember, we're doing this slowly and deliberately, right? We go inside out there. Now, of course, I'm wearing PPE as we're doing this also, at least with the gloves on.
The assistant should wear the same or one level PPE lower.
So you just
Sit out. And this might be difficult, so don't be afraid to use trauma shears to cut this away from the responder.
That's right. That suit's not going to be reused after this type of incident, right? So, and that's a very good point because that, again, frees it. Remember, your chance of being contaminated is greater when you're taking the stuff off than any other time. So doffing is the area of potential cross-contamination.
I just have my mic pulled off here.
Yeah, I think we're still good. So
Okay.
last, Tony's going to get his boots, the goggles, and then his mask.
Yeah, if I had trauma shears with me right now, we can cut that off. And
Yeah, especially if those got quite a bit of contamination on them.
yeah, you don't want to have to go through this.
Well, I don't want to cut these necessarily now, but anytime you put, of course, rubber boot on, they come off hard. So cutting those away from you if they're contaminated is not at all a bad idea. All right.
Jeez. Okay. So, at this point, actually I would have contaminated my gloves, but pull the mask away, actually I got eye protection. First, pull the mask away, I had my eyes closed, then I remove the outer gloves. There.
Okay, so rubber boots, feel free to cut those away as needed. Okay, they can be spot decontaminated. And another process here to think about before you take this stuff off, and maybe we could have covered this, but one of the recommendations is to have a quart bottle of the Brutab S disinfectant on your apparatus with you. And a good use for this is, remember, you know, if we reduce the level of pathogens, right, disinfect, so to speak. So we could take Tony's wearing these rubber boots. We could, and this is one of the biological recommendations as well, is spot disinfect the areas that got stuff on it, right? And just wait, right? Wait for, I know you kind of want to get this stuff off you, but it's safe. So disinfect these boots and stuff like that, and if you have some gross contamination on your knees or something like that from the suit, go ahead and disinfect that with the spray bottle. That's one of the uses of that. And then just wait that 10-minute time frame for that to dwell. And you've now killed these agents, these pathogens that you're worried about prior to even taking the stuff off, right? And so that's another strategy for, you know, protecting yourself and from the pathogens and stuff like that, you know, as you're in the PPE. Okay, so make sure you're carrying that quart bottle of, and you can also use that to spray your EMS gear and stuff like that. You know, after the call, put it back in the apparatus. You know, the dwell time is from the leaving the incident back to the station, right? So,
and just again, you know, not cutting those off might not be the greatest example, but remember when you're cutting the suit away from the individual and or the boots, that you want to roll the material away from the responder. Don't just pull it off. You're going to roll it away, basically turning it inside out, and you're again keeping containment of any garbage that's on there.
yeah, good.
All right, that's good.